All right. Thank you guys so much for your patience today. Sorry, we are starting about a minute behind time, but I am going to go ahead and share my screen. So let me know if you are able to see my presentation by raising your hands. Okay, here we go. Hands are up. All right, welcome to the pregnancy orientation for Full Circle Women's Care. I'm your host, Dr. Adams. Some of you had your history visits earlier today. Some of you will have them with me possibly tomorrow. And some of you, we've already had this conversation. So thanks for remembering me today. I will try to be a good steward of your time. Couple housekeeping things. One, this is confidential. So as you raised your hands and nobody could see who it was, I could see. I will get a list of who attended, but please feel free to ask questions along the way because no one will be able to see your name. If I think it's something too personal, I may say, hey, let's hold this one off until we see you back in the office. So participate, answer the poll questions, and let's all try to learn some stuff together. If you have to hop off at any point, because I might run into dinner time, the rest of this presentation will be available on our YouTube channel through the duration of your pregnancy. So we're going to start with a poll question. So you'll just see how they go. This question will pop up like this one says, who's on the call? So how many first-time moms do I have here and how many mommy veterans do I have in the audience? And I'll talk for a moment and then I will say the polls are closing. I'll close the polls and I will publish the results. And this time the mommy veterans outnumber the first-time moms. So this also helps me to decide, what direction I'm going to take it in. According to who is on the call with me. So the things we're going to go over today will include the full circle experience, which includes where we deliver. We'll go through some of our office protocols, like how to get in touch with us, what to expect at each of your pregnancy visits. We'll go through a lot of prenatal resources, talk about exercise and nutrition in pregnancy, and we'll end with an upper respiratory illness update. So first, just a little bit about our philosophy here at Full Circle. We're a collaborative midwifery model practice, which is based on the premise that pregnancy and birth are normal life processes, not a disease that we have to cure you of, but something normal and physiologic. The traditional midwifery model is based on that premise, and so they care for low-risk women. And if they identify certain abnormalities, they have to transfer them out of traditional care in order to be able to access a physician. Within the collaborative model, though, you can still stay in the care of the midwives, but we both have the benefit of physician direction. So, to that end, most of the labors and deliveries are attended by the nurse midwives because they are the experts in physiological labor. Even though the pregnancy has some abnormality, the labor can still be physiologic. So, midwives still do most of our deliveries, including our vaginal birth after cesareans. If there's something that is beyond the midwife's scope, they consult us. So if it's something urgent, like it can't wait until the morning or be scheduled, then they call one of us, Dr. Merrow, Dr. Mooney, myself. We're always on call for our practice. One of us will be there to back up the midwives. If it's something emergent, like it can't wait the 15 minutes it takes for one of us to come into the hospital to manage the labor, we have board certified OBGYNs who are in-house 24 hours a day. To put it in perspective, in 2023, we did almost 550 deliveries, and only 3 times did the hospitalists have to become involved. And I will tell you, the most common emergency is actually that somebody just came in 10 centimeters and neither the midwife nor the physician had time to get there, and not true emergencies where something bad is happening to people. So we deliver at HCA Florida Hospital, which is less than 10 minutes from our office. And we moved here, for those of you who were with us before 2023 and delivered with us at Ascension, we did move here in 2023, and it has been fantastic in terms of support for how Full Circle does birth. They do tours, so if you'd like to see the facility, I highly recommend it. There will be times that, we're recommending that you get this done. They have a stork tour, which is like a giant baby shower that they do every quarter. Very cute. They have food, they have tours, they raffle off prizes. It's very sweet. Doulas come and set up tables and fairs. But between the stork tours, I think the last one was in May, and the next one is in August. Between that, though, like if you're not available to make it, those times don't work for you, just go to the HCA website and click on register for a class, and you'll select the labor and delivery tour. Brittany is a childbirth educator, and she does them twice a month. So just pick a date and register for the tour. I do have a question here already. Question I have is, oh, do you have a translator? Okay, I'm so sorry. I do not have a translator. My guess is this is Spanish. No tengo traductor. Um, and I did find out that that we don't have Spanish subtitles on YouTube, but I'm working on that also. So I apologize. You can, however, watch, puede mirar con subtítulos en inglés y usar Google Translate to translate it for you. All right, I know a little bit of Spanish. It's not amazing though. All right, we'll go into our office hours here. We are open Monday through Friday from 9 a.m. to 1 p.m. We close for lunch from 1 to 2. So if you call us between 1 and 2, you will get the voicemail saying that this is the after hours line. It does not mean that our phones are broken or that we are actually closed. We use that because the after hours line connects to the person who's on call. So if you have a medical emergency between 1 and 2, you still have access to our emergency provider on call. Because of that, we ask that you don't leave administrative messages on the phone between 1 and 2. Just give us a call back at 2 o'clock when the front desk staff is back up there. We reopen at 2 and we're there until 5. On Friday, we do close at 1 p.m. So if you have administrative issue at 12:53 on a Friday and you are calling and you leave a message for front desk, it may be addressed when we reopen on Monday at 9. We do not typically do walk-in appointments. Our goal is to see you as close as possible to your appointment time. And if I promise you the 12:40 spot and somebody walks in at 12:30 and says they have an emergency, that's not fair to you. You have reserved this time, driven across town, taken off work, or found childcare so that you're on time for your appointment, and I need to be on time to see you. To that end, we have a limited number of same day appointments, but if someone is calling in saying, hey, I think I need to be seen today, that people deliver, they fall off, they cancel, and we can put you in one of those appointments. Now, if you're calling, say you're calling at 10 a.m. with something you're saying, I think I need to be seen today, and you talk to Sierra, our nurse, and she says, man, I really do think you need to be seen today, but we don't have an appointment until 3:40. I don't think you should wait until 3:40. She might suggest that you either go to labor and delivery or be seen at an urgent care. It's not us saying that we don't want to see you. It's agreeing with you that your problem actually does need more urgent attention than we're able to do in our scheduled controlled environment here in the office. So when you call, you won't actually speak to one of us because we're seeing patients at the time that we scheduled to see them. So we can't leave their appointments. Again, that's not fair to the person who's here in the office to take phone calls. But you do need to leave a message in order to get a call back. And we want to make sure that you leave the message with the right person so that you get the right attention. So Sierra it's in charge of a lot of pregnancy administrative stuff like letters, forms, and nurse calls. So if you call the clinical matter, I'm not sure about my baby's movements. I think I have a UTI. Maybe it's a yeast infection. Sierra's the one you're going to talk to. There are a lot of things that are very common and recurrent in pregnancy that she can just answer without needing to stop and check with us. She'll leave us a message to make sure that we agree. But if there's something outside her scope, then give her a chance to reach out to one of us, get an answer, and get back to you. Your OB clinical coordinator is Naisha. Many of you have already had contact with her because she's the one who will email you your labs after you have your history visit with me. She also does referrals if you need to see the high risk doctors, cardiologists, hematologists, and at the end of pregnancy, if you need something scheduled like a C section or an induction or baby circumcision, Naisha is the one who coordinates that with the hospital. And then for administrative things in terms of your insurance, Renee Hall, our benefits coordinator, who most of you met with to scan the QR code to join this Zoom. If anything changes about your insurance, some of you are going to be pregnant over the December into January. So if anything changes, please let Renee know and she'll be sure to answer those questions for you. After hours, there is always someone on call for our practice from our practice. This is the person that you call if you think you need to go to the hospital. So if you need to go to the hospital, that's where she is. So this isn't someone that you call and say, man, I forgot, what so and so said at my visit today. Can you repeat it for me? She doesn't have time to look in the chart. She's taking care of people with emergencies in the hospital. You must leave a voicemail message to receive a call back. The phone doesn't register phone calls unless you follow the prompts and leave that voicemail. The patient portal is another way to reach us, but do remember that response times can take up to 2 business days. Business days. So if you send a message on Thursday, the next business day is Friday, the next business day is Monday. So don't send anything on a Thursday that you can't wait until Monday to hear back about. If it is a non-action item, like you're just wondering whether or not you can continue to drink this certain tea that you like, that's something that we might answer at your next prenatal visit. The portal is best used for things like, oh man, Kayla gave me my lab slip and I can't find it. I don't want to go to Quest without it. And that's something we can resend you a copy of it. Or if you have some upper respiratory issue and you need to convert your visit to virtual, then you can send a message to front desk using, the appointment request, and they can help you with that. What we don't want you to send on the portal are urgent matters. So when people like people still do this. They send me, my blood pressure has been sky high and I don't feel my baby move. And I'm like, this isn't something that can wait 2 business days. If you're bleeding heavily, that is a phone call to the emergency on-call provider. Blitz messaging also does not help that matter. If you send a message to Lauren and she doesn't answer, so 2 hours later you send it to Vanessa, 2 hours later you send it to Colette, that is abuse of the portal. And also multiple messages, cutting and pasting them to different providers will make the system think you're a bot and it will delete your portal account altogether. We had someone very upset that she had 5 prescriptions waiting for her at the pharmacy for her UTI, but she messaged 5 people. So 5 people working on one problem is also not an efficient use of our time because we want to take care of all of you. We also ask that you don't attempt to have a visit over the portal. If you have questions that are in depth, I've been reading this article and I'm wondering what the pros and cons are of this. That's not a portal message. That's a visit. So text yourself questions that you can bring to your visit or schedule an appointment because we would love to talk about the pros and cons at your appointment. We also use our portal for ultrasound. Reports. So unless there's something urgently abnormal, we're going to let you go. The sonographers are excellent. They've been doing this for many, many years, and they know when there is something abnormal that shouldn't walk out the door without a plan. So they will not let you leave. They'll put you in a room. This is the one time that we'll break our schedule, come and talk to you, and make a plan for what was seen on the ultrasound. Otherwise, the sonographers complete their report and send it into our electronic medical record system where it's distributed to each of us, and then we review it and send it out within 2 business days to the portal. If you know that your anxiety will not let you wait 2 business days to find out what was on the report, definitely schedule a prenatal visit on the same day as your ultrasound visit, after the ultrasound visit, because the sonographers can print a preliminary report for us to answer any quick questions that you have about what was seen. Otherwise, if we let you leave, it was okay. So give us a chance to receive the report, review it, and respond over the portal. Same thing with Quest. They have a portal where they send you the results and sometimes not us. When you get the results, you see that there's all this red on the paper. It freaks you out. You start Googling. Please don't Google. Red doesn't necessarily mean abnormal. Pregnancy reference ranges are different. So they are setting this to people who are not pregnant. Pregnancy has some physiologic changes that will change what your blood work results are. So give us a chance to receive the labs from Quest. We don't want you to upload them to the portal and have us answer the questions there and then receive it again from Quest and have us upload it to the portal to release to you. If you've had your results for over a week and you have not heard from us, let us know because there is sometimes a chance that we do not receive them. The most common reason, though, that we don't receive them is if you're using a different name at the lab than you're using at our office. Please, please, please be the same person at all times. Use the same name at all facilities. Sometimes you got married, haven't changed your name yet. Your insurance doesn't think this. You're a Smith in your heart, but you're a Johnson at the insurance company. Please let your name that you use here match what you use at the high-risk doctors, the cardiologist, the hospital. Our electronic medical record system goes by your first, last name, and date of birth. It has to match all of those. If we find somebody that does not match those, it does not go into your chart and it does not get sent to a provider to review. So when you use an alternative name, it guarantees delays in us getting your results to you. Any questions about reaching out to us? Okay. Fantastic. All right, next thing is what to expect at your prenatal visit. So, one, expect that you are going to forget all the questions that you had leading up to your visit. So, start a text thread with yourself in your phone where you can text yourself questions. I love it when at the end of visits I say, all right, did you have any questions for me? And y'all pull out your phone and you say, actually, I do. And then you read off your questions and you know that you didn't forget anything that you needed to ask me. We want you to wear loose, comfortable clothing so we can access your belly because at every visit, we'll be listening to your baby's heartbeat, not ultrasound, but listening to baby's heartbeat. We want you to get here about 5 minutes before your scheduled appointment so you'll have time to check in and handle any front desk business. And if you need to leave a urine sample, you'll have time to do that too. Everybody does not need to leave a urine sample. The American College of Obstetricians said we no longer need to do that. But if you had a recent urinary tract infection and we're testing to see if you're cured, if you have high blood pressures and we're looking for protein, or if you have high blood sugars and we're looking to see if you're spilling glucose, then that will be a reason for a urine sample. And you'll know, and front desk will know too if you need to leave one. If you're 10 minutes late to your appointment, we'll still have time to check on you and your baby, but that leaves less time for our little text thread message. If you're 20 minutes late, you have missed the entire appointment slot. And the person who's behind you is definitely here 5 minutes before her appointment time. And so we want to be respectful of your fellow patient's time as well. We may be able to work you into the schedule later. Again, some of those same day cancellations that had happened, or we can reschedule to another time that is that's convenient for all parties. When am I having another ultrasound, Dr. Adams? You just said you're not doing one at every visit. Oh, you were listening. Diagnostic ultrasound appointments are separate from prenatal visits. So the way to know if you have one scheduled is look in your portal and see, do you have two appointment times? And is there a provider's name associated with your visit? So let's say your name is Tina Test and you're my imaginary patient who logs into her portal and clicks on the appointment button. When she does that, it shows her what her upcoming appointments are going to be. So at 9:20, she has an appointment with ultrasound. That is not a provider's name. Then at 10 o'clock, she has an appointment with Dr. Yeckel. That is a provider's name. So Tina is going to have an ultrasound at 9:20. She can tell her family, come along, let's see the baby. And then at 10 o'clock, Dr. Yeckel can go over a preliminary result with her. Remember, if she does not have that appointment with a provider afterward, the results will come to her portal within 2 business days, unless there's something urgently abnormal, in which case we will stop you before you get to the door and put you in a room and discuss those findings. When you're coming out of your visit, say you're about 16-ish weeks and your midwife says, hey, it's time for your ultrasound next time. When you go to check out, be sure front desk schedules 2 appointments, your regular prenatal care visit and an ultrasound when the ultrasound is due. Now, if you say, but Colette, I really want to see my baby, and she says, but it's not time yet. Here's an option for you. Boutique ultrasounds. These are just for fun. Ours are diagnostic. We're looking for something medical. These are just looking for fun. I put a couple on here for informational purposes. I know there's one in St. Augustine as well, but just know that these places do fun ultrasounds and they are perfectly safe. There's no radiation in ultrasounds. Some of them do they do 3D ultrasounds. They'll put your baby's heartbeat in a stuffed animal. It's super cute. So just know that this is an option if you need to see your baby more than medically we need to see the baby. So the question I have here it says can't go tomorrow. We'll have to talk about that one at your next visit. All right, but we are ready for a poll question right now. So our next poll question has to do with ultrasounds. So when can you expect to have an ultrasound? Should you get them at every single visit? Will you get them at 20 weeks, 40 weeks, 41 plus weeks, or do you only get ultrasounds if we think something is wrong? And the polls are closing in 5, 4, 3, 2, 1. Done. All right. So they're not at every visit. The ultrasounds are not at every visit. We will listen to your baby's heart rate with the Doppler at every visit, but not do an ultrasound every time. Your anatomy ultrasound is about 20 weeks. If we see everything we need to see and there are no other issues, you don't need another one until after you pass your due date, 40 weeks. And we will look again, though, if you have any problems on the ultrasound, but that's not considered routine. Those are only if there was something that we didn't see on the anatomy ultrasound. All right, so we are going to actually flip over to our website. So let me know if you're able to see the Full Circle website by raising your hand. Okay, cool. All right, so this is Full Circle Jacks, and you'll see pictures here under providers of the people who will be taking care of you. So there's me, Dr. Marrow, Dr. Yeckel, Dr. Mooney. There's some midwives on here as well, Vanessa, our PA. So feel free to take a look through, read our bios, find out what we have in common. Over here under patient information, you'll see the obstetrics tab, and you'll know you're in the right place because you'll see all the growing bellies and the baby here at the end. Delivery statistics, many of you are here because of our delivery statistics. So what's your chance of getting a C-section? What's your chance of having a successful vaginal birth if you've had a C-section before? Take a look. Those are in there, I think, back to 2018. We're very proud of our stats. Don't mess them up, please. Prenatal care timeline. This is what to expect at each visit. So everyone on this call has already had your first visit where we did your pregnancy confirmation. About a week or two after that, you'll typically have your history visit, which is a virtual visit with me, where we go over your medical history, your family history, and I order some blood work. So this blood work that you see here on the screen are the standard labs that are recommended by the American College of Obstetricians. Your homework is to try to get that blood work done as soon as you can after our visit. There may be other things I identify in our history that I want to check, and I may order some additional labs based on this, but we'll talk about those individually. You have to be at least 10 weeks to do the genetic testing, the NIPT. So typically we talk about that when I do your history visit, and then I order that for you. If you're planning to do the nuchal translucency ultrasound, that's usually done between 12 and 14 weeks as well. At this point in pregnancy, we are seeing you every 4 weeks. So about 4 weeks after your initial visit, the ultrasound that gave you your due date, you're coming back to the office for your physical exam. Pap test is listed on here, but it's not part of the routine prenatal panel. Cervical screening is. So we do need cervical cultures, but if you're due for a PAP, you're welcome to get one here, but you can always say you don't want to have a PAP during pregnancy and defer it until afterward. Those of you who need to see a high-risk doctor, that's typically when I see you for your history visit, I send the referral, and they usually see you right around 13, 14 weeks or so. Then we're entering into second trimester. Yay. We have a visit here 4 weeks later, and we talk about some genetic stuff, and we talk about other common issues in second trimester, like wrong ligament pain. It's also when you start feeling the baby move, so that's exciting. Then about 4 weeks later, you're back in for your anatomy ultrasound at 20 weeks. And remember, if you're meeting with a midwife on that same day, she'll go over the preliminary results with you. She'll also maybe talk about childbirth education and breastfeeding classes. You'll see here in the middle the mental health screen. If during your history identify that we have a history of depression or anxiety, everyone will get screened, but we don't want to get behind with this because while postpartum depression gets a lot of press, there's postpartum rage, there's postpartum anxiety, there's antepartum rage. Like sometimes pregnancy just comes with feelings, and we want to be sure that we're taking care of the whole person throughout the pregnancy. So about 4 weeks later is when we do the glucose test. And I know I'll have questions about that, so just hold them until we get to the section on glucose. My moms who know that their blood type is Rh negative, we are making sure that we have RhoGAM to give to you before 30 weeks. This is when we're going to give you the information to pre-register at the hospital. Those of you who were with us before, it used to be papers that you mailed in. Everything is online now. There's something you scan at the front desk to pre-register at the hospital. We want you to schedule a hospital tour, either one of those quarterly stork tours or your own individual ones. And if you don't have a doula yet, which doulas now book up from first trimester, we want to make sure that going into third trimester, you definitely have who you're going to work with. And we'll talk about doulas in a moment too. Now we're in third trimester, home stretch, and we start seeing you every 2 weeks. So first time moms, this is when you want to start looking for who your pediatrician is. We have some brochures and business cards outside of our restrooms in the front. Veteran moms decide if you're going to stay with your same pediatrician and make sure that they know that you have another baby coming. You'll see here in the middle the option to repeat or decline your standard prenatal labs. The American College of Obstetricians recommends doing them at least once. Duval County Health Department recommends certain high-risk populations repeat them. If you feel you are not in a high-risk population, we do have a form that you can sign stating that you choose to decline them. 32 weeks, if you have some pregnancy co-issue like high blood pressure or diabetes, we start doing some additional testing for you, and we continue with the every 2 week visits until about 36 weeks. My belly birth moms, which is our word for the C-section, we usually get those scheduled for you right around 33 weeks. You'll typically be seeing Vanessa, our PA, and so Vanessa will send a message to Naisha to get you scheduled so that you can start planning. And then at 36 weeks, everyone gets swabbed for group beta strep, and we'll talk about what that is in that visit and why it's important. And if you've opted out of repeating your STI cultures, you can also opt out of repeating them here. This is when we start seeing you weekly. So at 37 weeks, you are considered full term. So bring in your birth plan so we can talk about it. Start your natural cervical ripening methods, and then at 39 weeks, everyone who's expecting the belly birth is usually jumping off the train by then. Sometimes it's between 37 and 39 based on your personal circumstances. For everyone else who's waiting for baby to give the signal for labor, be patient, be patient, be patient. We'll start doing some testing to make sure it's safe to continue the pregnancy. And then all passengers out of the vehicle by 42 weeks. And we'd schedule inductions for first time moms, at 41 weeks and 5 days. And for veteran moms by 41 weeks and 6 days, because your labor is usually faster. Excuse me. First time moms, the average length of labor for you is about 24 hours. So just knowing that going in, just second time moms definitely know that it is definitely about half whatever it was the first time. So my next poll question that I have is about medication. So pregnancy safe medication is the next box that's on here. If you have a headache, are you more likely to take a Tylenol, meditate, or go to the ER? Hopefully you don't do that. The ER is very expensive. All right, the polls are closing in 5, 4, 3, 2, 1, done. All right, and we have just as many meditators as medicators on the line today. For me, I'm probably a Tylenol gal, but to each his own. All right, this is our list of safe medications in pregnancy. So pregnancy comes with a lot of stuff that people really probably didn't talk a whole lot about: the constipation, the fatigue, the gas. So what you'll see on here are relief measures. So things we'll want you to try first. And then if those things don't work, over here is your trip to Walgreens or CVS for some medications. And not everything in the medication list is Western medicine either. There are some things like aloe tablets. We've got peppermint oil and B complex, papaya enzymes. But really, these are the things that we want you to try before reaching out to us. So when people reach out and say, "Oh, Dr. A, I have constipation. Is there anything that I can take for it?" First thing I'm going to say is, have you tried everything on this list? Because if you've tried everything on this list, I mean, we're really almost at the point of an enema. But just realize that there are some things that you can try first before reaching out to us. But if you're unable to keep any food or drink down for 24 hours, please don't keep just taking ginger and vitamin B6. You need to contact us because you're getting very dehydrated, and we have to make sure that your kidneys and your baby stay perfused. So remember that this is out there on our website. For gestational diabetes, I'm not going to talk about it right this moment, but just remember that this document is out here, and it has information on how to prepare for the test and on alternatives for the test. Just remember I said that, because then we're going to come back to it in just a little bit. Weight gain in pregnancy. Some are very concerned that you haven't gained any weight in pregnancy. I'm a third of the way through. I'm 12 weeks already, and I haven't gained any weight. That's okay. Over here, you'll see in this last column, the rates of weight gain are in your second and third trimester. First trimester is survival mode. Your baby craves carbs, you are sick, you're tired, you're all the things. Like you go ahead and eat the carbs this trimester. Next trimester, we're going to do some parenting and tell that baby to put down the candy. There's a link on here to calculate your pre-pregnancy body mass index. Based on the number that you come up with from your height and your weight, it tells you how much weight you should be gaining in pregnancy. And again, that is measured in your second and your third trimester per week. So just remember that that is out there if you start to freak out about your weight gain. Next, we have birth preferences. So this is very helpful for those who are trying for, really, this is nice for first-time moms who are anxious because you've never seen this before. Um, and the information in here, it can get overwhelming. Like everybody on the internet has an opinion about what you should wear when you're in labor and how you should be monitored and all that stuff. And it can be a lot if you don't know what your choices are. So this can help to decrease some of the anxiety around your birth experience by being able to look up a couple of things and bring them in and have a conversation with your midwife about what you're looking for in your birth experience. So a couple of things to highlight. We do have wireless monitoring. We do have hydrotherapy, meaning tubs for labor. Nitrous oxide is on here. It is in the building, but we're still working on the policy for it, so it's not available today, but hopefully by the time you deliver, it will be. We do not starve you. We do not strap you to the bed. We want you to walk around. We don't care what position you push in. We don't care what position you deliver in. All these things are fine. Our usual is warm compresses to the perineum, immediate skin to skin, delayed cord clamping. Those are full circle standards. So the newborn meds are on here for you to look up as well and bring in and ask your midwife questions about them too. Some people have twins. There are choices for twins too. And then belly births, we do gentle cesareans, which are family-centered cesareans. So you have questions and you have options as well. So 21 boxes, not every single one of them will apply to you. So take them one box at a week. And that is a very easy way to just kind of narrow down what you're looking for. And then at the 37-week mark, you can bring it in and talk to your midwife about your birth experience. The question I have is, can you send me this content by email? Actually, this is going to be available on our YouTube channel, and I am typing in our YouTube channel for your answer that it is at Full Circle Jacks on YouTube. All right. Next, we have cervical ripening techniques. And you will see on here lots of different things. You can start some as early as 20 weeks, raspberry leaf tea. There are other things like acupuncture, acupressure, intercourse, evening primrose oil, using your breast pump, clary sage, all that good stuff. Membrane sweeps. So again, this is for later on in pregnancy. Not everything I'm going to talk about today is for use right now. You may want to come back to this and watch this maybe once a trimester for certain parts to get all of those. My next question I have for you is whether or not there are any moms who are on the line who've had a C-section before or a belly birth before and are looking to have a vaginal delivery. I know this won't apply to my first-time moms. But okay, cool. All right, so the only two choices, either it's not you or you're gonna rock it because don't mess up my stats. All right, we're closing the poll and sharing the results. Actually, we have quite a few VBAC moms on the phone today. Very good. Welcome to the club, ladies. Control what you can. Anyone who's had a belly birth knows that there are some things that they cannot control because they probably would have controlled that part last time. Babies are going to baby. Placenta is going to placenta. But there are some things that we can do on our end to give ourselves the best chance. If you're struggling with what happened in your prior birth, please talk to somebody, release that fear. Do not sabotage yourself by remembering and bringing back all that baggage from a prior delivery. Webster certified chiropractic care, which we'll talk about in a second, pregnancy yoga or Pilates, method specific courses, squats. I'm going to talk about those too. Watch your weight gain in pregnancy, and then hiring an experienced doula. Doing spinning babies, because I will tell you, first time moms, I did say that this was for that this was for moms who had a previous cesarean. Sorry, somebody doesn't know that I work all day. But this is for first time moms too. The most common reason that we are doing Cesareans is not because baby is too big or baby is in distress. It is because baby's head is crooked in the pelvis. And so making sure that your baby is in optimal position is important to decrease your risk. And then just trust us because we don't want to do a bunch of C-sections. We really don't. So we're not going to be pushing you into things that are going to increase your risk for C-section. Also, if you have a little guy and you want to have him circumcised, this is not something that we do in the hospital. We do it in the office before he is 10 days old. So when you deliver, the midwife will typically ask, "Hey, did you plan a circumcision for him?" If you say yes, Naisha will then call you to make sure that we get him his first little appointment with us. And this is information on how to take care of the circumcision. All right. So if there are no questions on the website, then we will go back to the presentation and let me know that you are able to see this delicious salted caramel mocha, whatever, by raising your hand. Okay, very good. All right, Dr. Adams, I don't know why I'm gaining all this weight. All I have in the morning is coffee. Is it? Is it really just coffee? Did you know pregnancy only requires an additional 300 calories per day? It takes 10 calories to maintain a pound of body weight, and your goal weight gain is based on that sheet that we just saw, the starting body mass index. So if you're starting your pregnancy at 170 pounds, it takes 1,700 net calories to maintain that. If your goal is that you need to gain 25 pounds during pregnancy to support a healthy pregnancy, that's 250 more calories for a total daily caloric intake of 1950. Split that between breakfast, lunch, and dinner, and that is 650 calories per meal. And that's food and drink. So if you eat your 650, you cannot wash it down with 570 calories of mocha caramel monstrosity from wherever that wonderful place was. It's one of my favorite drinks. Um, this slide just kind of emphasizes how important small changes can be. So later on in pregnancy, when you start swelling, switching from traditional spaghetti sauce to 20-minute herb-infused marinara can cut out 500 milligrams of sodium and probably get your rings to fit back on your fingers again. Other things like watching how, like the calories, we talked about how many calories, but how many calories come from fat? How many come from carbohydrates? How many come from proteins? Things you want to eat are your fruits, veggies, whole grains, cereal. You won't give your baby an allergy to nuts or dairy if you eat those things, so carry on. My coffee drinkers, you want to limit your caffeine to less than 200 milligrams daily. Herbal teas are fine. Some of our favorites, as you saw, were raspberry leaf. We also like ginger, lemon, and peppermint. For my pescatarians or vegetarians, your protein sources, be sure you're getting 70 grams of protein a day. I know there are some pregnancy diets that say 120 grams of protein. Please don't do that. You're going to grow an 11-pound baby. 70 grams is a real sweet spot to satisfy you and baby and grow a normal size human. You can have deli meat. You can, as long as you microwave it for 30 seconds. It does not have to be piping hot straight out of the microwave. You can let it cool down, but that 30 seconds is important to kill any harmful bacteria. Soft cheeses are fine as long as they are made with pasteurized milk, and you can have 3 cans of the 4-ounce tuna every week. If you are pescatarian and need to eat more fish than that, the FDA has a really nice document. This is the most recent iteration of it, October 2021, about which fish to avoid because of methylmercuries, to eat sparingly because they're neutral, and to eat more of because they have high DHA, which is good for baby's brain development. No matter what kind of fish, you want to make sure it's cooked. So you want to avoid undercooked meats and fish. So if you like your steaks the way I do, medium, you will have to ruin them for the next 6 months and make them well done. My kombucha drinkers, my kimchi eaters, my sauerkraut people, these things are fermented and your body can treat them as alcohol sometimes. So you want to limit those. For alcohol, you want to cut it out because we don't know how much alcohol is safe because fetal alcohol syndrome is a syndrome that does exist and we don't know the threshold for creating that. And you want to keep your sodium to under 1,500 milligrams per day. Think back to that slide about the spaghetti sauce, 500 milligrams in one serving. So if it's 1,500 for the day, your urban infused marinara is where it is. Any questions about food before we move into All right, I was already taking in 100, 120 grams of protein a day before pregnancy. I work out 4 to 5 times a week. Should I decrease the amount? Yes, because your protein is going to be differently distributed now. Because I'm imagining before you using it for building your own muscle, you will build muscle too, but it won't just be yours. You have a big old muscular baby, and that's not that's not ideal. But yes, you want to cut back on your protein in pregnancy because you also want to be mindful of your baby's size. Exercise in pregnancy. So it is okay to continue your pre-pregnancy activity, though. If you were doing the exercise the aerobic exercise and weightlifting, that's fine. We'll talk specifically about your exercises. You just, in the first trimester, we know that you don't feel like it. It's okay. No judgment. Second trimester, though, you'll have some physiologic changes. You'll increase your blood volume, oxygen, tension, and saturations, and that'll accommodate more aerobic activity. So just listen to your body on when you start to get that energy back. It is fine to start a new regimen if you weren't doing anything before, because being sedentary leads to malpositioned babies, which leads to belly births, which are still beautiful and family centered, but that's not my goal. And I'm thinking it's not your goal either. Those of you with these Fitbit watches, Apple watches that track your heart rate and you have anxiety over the fact that your heart rate's going up, just know physiologically it is normal for your resting heart rate to go up 10 to 20 beats per minute. If you are walking as your exercise, walking counts as exercise if your heart rate is in the aerobic zone, 70% of your max heart rate. So 220 minus your age is your max heart rate. So if you are 30 years old, you should not be exercising with your heart rate above 190 for extended periods of time. 70% of that is 133. So if you're walking for your exercise, your heart rate needs to be between 133 and 190 for 30 minutes at least 3 times a week. That means your walking is exercise. Otherwise, your walking is transportation, which is also important, but it's not exercise. So for exercise, you can do some cardio, treadmill, elliptical, running, swimming. You can do an indoor bike, weightlifting, whatever you were lifting before pregnancy, continue. You don't need to go up on your weights and resistance because your body and your baby are going to increase the amount that you are lifting. Squats, again, I mentioned those are my favorite. A minimum of 500 per day. I would love it if you shot oh, I said 500. Freudian. 50 per day. 100 would be amazing. 500 would be amazing. But 50 gets that pelvis open, long, and lean, lets that baby settle into the appropriate position. If you're not an experienced squatter, you can start at 20 weeks, give me 5 a day, 21 weeks, give me 10 a day, build your way up to a minimum of 50. And again, Pilates and yoga carried out with any experienced instructor, they'll be able to tell you what the pregnancy modifications are. You want to avoid high interval training after high impact interval training after first trimester. It's not the intervals, it's the impact. So you can still do that training, just do the low impact version of it. Anything that has you lying on your back for excessive amounts of time, like ab work, you can do standing abs, you can do side lying abs, but just not lying on your back forever. Hot yoga, if you're a hot yoga instructor and are fully acclimated to that environment, you're fine. Otherwise, you may get dizzy and fall and possibly fall on your belly. So you want to avoid that. As well as scuba for decreased oxygen content in your blood. Same thing with high altitude hiking. If you have high altitude traveling to do, 8 to 10,000 feet above sea level is just fine to visit your family in Colorado. Just don't go hiking with them during that time. Contact sports, please do not take up kickboxing during this time. We've also had some pickleball incidents, so anything with a ball flying at you, maybe you want to avoid. And outdoor biking after 16 weeks is not a no, it's just to be careful because your center of gravity changes around 16 weeks and you may start to tip over as you try to turn those corners. All right, so we have a poll question now that we've talked about nutrition and exercise. Can you prevent gestational diabetes with nutrition and exercise? Can you? And the polls are closing in 5, 4, 3, 2, 1, and done. My veteran mamas know, because they probably heard me say this so many times, you cannot. The answer is no. So you can't prevent it. You can manage it with diet and exercise, but you cannot prevent it. And the reason why we screen everyone for gestational diabetes is because it is hormone driven. You know how we blame our hormones for literally everything? Same. These are the gestational diabetes is from hormones given off by your placenta. So your placenta gives off hormones that tell your insulin not to do its job. And the job of insulin is to clear the glucose from your system and take it into your cells to use as energy. If your insulin isn't doing that, then the glucose is still just out there hanging around in your bloodstream. And extra glucose in your bloodstream is diabetes. But it's diabetes because your placenta said so. So it's gestational diabetes. So if you don't have a placenta, then I don't need to screen you for gestational diabetes. But if you do have a placenta, then I do need to screen you for gestational diabetes. And if you have two placentas, twin mamas, then I absolutely need to screen you. Or my moms would say, but I never eat any carbs. You eat some good carbs. Don't avoid them prior to the test. So your fruits, your whole grains, you don't want to give yourself a false positive on the test because you're shocking your body by reintroducing carbohydrates in a concentrated way. If it is the drink itself, like the lab drink that bothers you, we have alternatives. So there's the Simply Pure drink, which is for sale here at Full Circle. It's soy free, it's dye free, it's gluten free, it's BVO free, it's kosher, it's vegan, it's offensive to almost no one. The other options are the fresh test, the glucoorganics, and the glucose tablets. That area that I showed you on the website that had that information, just if you click on it on Full Circle Jacks, our website, it has the links to them. Be sure that you order those ahead of time because they are typically on back order. So go ahead and place your orders around 20 or 22 weeks so that we can get your testing in around 24 to 28 weeks. And let your midwife know if you plan to use one of these alternative sources because Quest does not accept outside source drinks. We'll have to send you to LabCorp to get your testing done. All right. Preparing for birth. So things your midwife will talk to you about. These are this is some information about method classes. So hypnobirthing is represented here, hypnobabies. I think Lamaze maybe on here, and probably Bradley method. And then supporting her for partners who don't know what to say and may get in a lot of trouble for saying the first thing in their heads when they're in labor. Definitely take this course if you're the kind of person who gets in trouble for what you say when she's not pregnant. Breastfeeding classes are offered at HCA as well. La Leche League also has some. Midwives can give you more information about that. Every new parent should know CPR. Here's a link to the Red Cross. Even if you know adult CPR, infant CPR is different. Chiropractic care. If you're already seeing a chiropractor, good for you. If you are not, consider it. Because again, baby position is so important. Be sure your chiropractor is Webster certified, which is a special certification, a special qualification to take care of pregnant people because your body makes certain changes and certain adjustments are not appropriate for pregnant women. And so Webster certification is important for that. Also curious, how many of you are planning to work with a doula? I know I talked to some of you for your prenatal visits and you were already signed up and I was so impressed. Polls are closing in 3, 2, 1. All right, so most of you are. Oh my gosh, I think this is probably my biggest group of people who plan to work with a doula. Fantastic. And there's only one here who isn't sure and maybe wants to know what a doula is. All right, so doulas are there. You're like, wait, I have a midwife, I have a doctor, I'll have a nurse, there's an anesthesiologist. Who are all these people? This is your team. So doulas are there to provide emotional and physical support before, during, and after pregnancy. So breathing techniques, changing position, relaxation strategies during your labor. They're not clinicians, so they're not prescribing any medicines or giving you medical advice or providing medical care. They're not delivering your baby. So, oh, I don't need a doula. I have a midwife. So the midwife typically will have 2 or 3, or if you're Lauren today, 5 patients in labor at the same time. So they're not in your room by your side the entire time. Your doula is your dedicated, personally hired by you advocate to stay next to your bed and help you do all of these things throughout your labor. The best doulas are the ones I've seen who are in touch with you from the time those contractions start. They come into the hospital and are by your side until your baby is out and latched and breastfeeding. So the midwives have lots of experience with doulas in the area, so ask them for their recommendations. They have no shortage of opinions on the doulas whom we've seen support our mamas throughout the years. Acupuncture is is amazing during pregnancy. Great for morning sickness. Great for hip or shoulder pain. Any of these weird joint laxity things. And then at the end, they do baby come out treatments, which are very nice too. I've delivered quite a few people who have their pressure point things on their ankles from their acupuncturist from earlier in the day. Pregnancy massage is also fine in second trimester and up. If you need a note from us, just send one of us a portal message and Naisha can send you our standard letter saying that it's fine. Most of your insurances will also cover breast pumps. We have a QR code in each exam room. So please scan our code at 20 weeks. Please don't go looking for how to find your own company that supplies it because they typically make the process more difficult. When I get portal messages from people saying, I've been trying to get this breast pump, it's because they didn't scan our QR code. If someone in your family needs to, or if you need to use the Family Medical Leave Act, we handle these through Leave Guru. They are a third-party vendor that have been completing the forms in about 24 hours, which is pretty amazing. If you've ever had these forms done here or anyplace else, honestly, they take up to 10 to 14 business days and are a pain for everyone involved. But Leave Guru, bless their hearts, have decided to take this off of our plates. So if someone needs to use FMLA, please reach out to Sierra and she'll get you information on getting on their app to get your forms completed. If you have any blood pressure issues during pregnancy, you'll be back in the office before your baby is 5 days old for a blood pressure check, assuming you're not still in the hospital for that reason. Belly birth moms, you come back in about 2 weeks to check your incision. Everyone gets routine mental health screen after 2 weeks. Baby blues are very common. 80% of women will have baby blues in the first 14 days. If they persist beyond the first 2 weeks, then we may be looking at postpartum depression, postpartum anxiety, postpartum rage, and we want to screen you and get ahead of that. Postpartum doulas are also a thing. So if they're for emotional and physical support, when do you need that more than right after you had a baby? They can also be part of your frontline defense on recognizing any postpartum mood disorders. The Motherhood Space is an amazing program here in Jacksonville. We're one of 5 cities in the country that received a grant for this, a joint venture between Baptist and the YMCA. So this is hosted at Winston, and they meet daily with yoga therapy, access to psychologists, and light therapy, all sorts of different things, postpartum counseling. So for moms who qualify for that, your insurance covers it or the grant covers it. And they have on-site childcare from 6 weeks to 12 years old. So, not having anybody to take care of your child while you get therapy is no longer a reason not to go. So if you're identified as a candidate, we'll refer you to the Motherhood Space. And then pelvic floor therapy, which is standard of care in many countries. That is Tracy, our nurse who comes in Tuesdays, Wednesdays, and Thursdays. If you're in network with us, you're in network with her. And she does things to help with postpartum pain from intercourse, postpartum prolapse, some of the things that happen after babies come through an area that has never had a baby come through it before, or even belly births. Sometimes just carrying around a baby for that long creates some laxity in the pelvic floor, and we want to help you get it back together. The question I have up here is, what about using short-term disability? That's fine too. Leave Guru does not handle short-term disability. They only handle FMLA, but the front desk and Sierra can help you get your short-term disability forms filled out as well. You can sleep on your left side, your right side, or your back. You can sleep on your back. If that makes you dizzy, though, you can get a wedge pillow to go under your hip. House painting, you want to help paint the nursery, that's fine. Just be sure you're in a well-ventilated area and wearing a mask. You can take probiotics and prebiotics. You can dye your hair, including your eyebrows. You can do gel nails. If you're in a salon that has a lot of fumes in it, you may want to wear a mask just to keep from getting dizzy, but there's nothing unsafe about them. This is the summer, so if y'all are doing car travel, go for it. Up to 37 weeks, because again, babies don't have calendars, and you're full term at 37 weeks. If you're someplace out of town, you have your baby with somebody that's not full circle, and that is just less than awesome. Just be sure you're getting out and stretching every couple of hours to make sure you're not getting clots in your legs. For skincare, you can use your benzoyl peroxide, your salicylic acid, anything topical except for retinol. Bakuchiol, Bakuchiol, is an alternative to retinol, and that you can use. And for flying, you can, for twins, up to 32 weeks is fine. For singletons, up to 36 weeks is fine. Just be sure you are wearing your compression hose, drinking lots of water, and doing toe raises to exercise your calves, again, to prevent blood clots in your legs or your lungs. Stay away from roller coasters and water slides. The lazy river is fine. I did have a couple of questions up here, but maybe I just answered them, so they moved. All right, guys. Last thing is our update on upper respiratory infections because they are back and going around again right now, which is very annoying. And everybody's testing negative for everything, but they're very, very sick. So, in terms of COVID, those who are still concerned about COVID and COVID vaccinations, the American College of Obstetricians strongly recommends it for anyone who is at high risk for contracting it. Moderna and Pfizer are fine. We don't recommend Johnson and Johnson because of its independent risk for blood clots, and this is based on the New England Journal study of 35,000 women who received it. All vaccines are approved for boosters. So if you plan to get it in such a way as to benefit your baby, you can do so in your early third trimester around the time of your tetanus booster or your RSV, depending on the season, long as you're 6 months past your Moderna or Pfizer. If you're 2 months past your Johnson and Johnson, then you're eligible for a booster, but not with Johnson and Johnson. You can mix and match, and that's fine. You don't have to time it at any particular time against the other ones. Just excuse me, early third trimester is best so that you will be able to create antibodies to pass to your body, to your baby during breastfeeding. If you do get RSV or COVID or the flu, there are no recommendations for these medications listed. What we do recommend is not coming here. Don't come here. Please don't get my staff sick because we have to be well to take care of you. So please convert to a virtual appointment because we do still want to check on you and see how you're doing, whether you need anything from us. We recommend vitamin D3, zinc, vitamin C, and if it's specifically COVID, a low dose aspirin, 81 milligrams until you're 36 weeks. If you get COVID after 36 weeks, then do not start the baby aspirin. Serial growth ultrasounds because we've seen higher rates of gestational hypertension in moms who contract COVID or have had COVID even prior to pregnancy. The question I have here is it's not necessary to do the tests in the first trimester that I've never done. The question is in Spanish, so I'm hoping that my translation is okay. In the first trimester, we repeat your standard labs each time. So if you've done your blood type in a previous pregnancy, we still retest your blood type again. If I didn't answer that question because my Spanish is a bit rusty, feel free to ask it again at your upcoming visit. For upper respiratory infections, again, supportive treatment at home is fine. You only need to go to the hospital if you're not able to breathe, can't bring your fever down under 101, if you have a pulse ox, if you're checking your oxygen, you're having trouble breathing, go to the hospital. Like, don't sit at home checking your oxygen and saying, I'm at 95%, I feel fine. For those of you who did have babies during COVID and are freaked out about what things were like then, take a deep breath. It's all very different now. We're back to our standard amount of visitors. You can have 4 visitors in labor plus your doula. So if you have a real doula, like a certified doula, then she doesn't count as a visitor. She's part of your birth team. We don't require masking routinely in the labor or in the room unless you are actively positive for a contagious upper respiratory infection. Even if you do have that, we're not separating from your baby. We give you an isolette that you can use in the room to protect your baby from your respiratory droplets. All right, next question I have is my blood. I'm A negative. My husband is B positive. It's our first baby. Will there be any problem? Not if you receive. So you have a couple choices there. You can either do the genetic testing, because I haven't done your history yet. You and I are going to talk about this a little more in your history. But for anyone else who's Rh negative, your choices are to do the genetic testing, which can tell you whether or not your baby is also Rh negative, in which case you don't need RhoGAM at all. Or you can't, if like you already know your husband's Rh positive, but if you don't know your husband's blood type and you're Rh negative, find out if he's Rh negative. That way you won't need RhoGAM either. But otherwise, if if we don't find out baby's blood type and we know that your husband is positive or the dad is positive, then we do recommend Brogam at 28 to 30 weeks. And the next question up here is, are the vaccines you mentioned required or just recommended, including RhoGAM? So RhoGAM isn't a vaccine, but that RhoGAM is strongly recommended. The vaccines are recommended. The CDC, ACOG, basically anyone who studies pregnancy does recommend it. They are not required though. Like you don't have to sign anything if you don't want it. If you decide you don't want RhoGAM, which again is not a vaccine, then you definitely do have to sign an against medical advice form because that one actually could kill future babies if you decide not to get that one. All right, our last question of the day is, what can you find on the website? Can you find your birth plan template, safe medications, what to expect at each visit, or are you a star test taker and you know that this is the right answer? All right. And the question I have here is, how many pounds can I lift? You can lift as many pounds as you could lift prior to pregnancy. Don't start trying to double how much you can lift. All right. And the answer is the one at the bottom, the one that says FYI. This is the correct answer. All right, very good. Any other questions out there? Thank you guys so much for your time. I appreciate you. Remember that this information is on our YouTube channel, so at Full Circle Jacks, and it will be out there through the rest of your pregnancy. Feel free to follow us on all the social things, and we look forward to seeing you back in the office at your next appointment, which you can find when that appointment is on your patient portal. All right, guys, have a great evening, and we'll see you soon. Bye.